Hey y'all, it's Dr. Stacy. I am coming to y'all with one of the most requested conversations that I have that people just, they want to know about or they don't understand. So today we're going to talk about FUPAs. Okay. Can we just be adults and talk about FUPA talk? Okay. So FUPA stands for fat upper pinky area. And we're going to make that P stand for pinky. Why? Because we're on social media, right? We can't use the other P word. So I will say that I was in residency and I was sitting across from a member of Kappa Alpha Psi, and he said the word FUPA, and I was like, what does that mean? I didn't know, y'all. So that's when I first figured out what FUPA meant. I was not one of the cool girls. So the FUPA is the other names that you can hear it called out in society is an apron. Or in the medical community, we call it a penis. And P-A-N-N-U-S. P-A-N-N-U-S. So that is, okay, so let's say here's your vagina. Above that, you have a upside down triangle, which is called the mons. Okay, it's an upside down triangle. And there is a fold there, a fold of skin. And if you have skin that hangs over, that's called the FUPA. The fat upper pinky area, also known as the penis. So why do I talk about this area? This is a huge area for female hygiene. And what I mean by that, if you have a FUPA, you have an increased risk of sweating, chafing, bacteria collection, just sweating, and then smelling. And I'm going to tell y'all what I recommend for people who have not had their FUPA or had a tummy tuck. What I recommend in terms of self-care for that area. I'm going to tell you what some of the benefits of having that area removed are. And then the third area I'm going to talk about is if you have a surgery in that area. So let's say a C-section, a hysterectomy, if fibroid surgery, ectopic pregnancy, anything, how to care for that area. Okay, so let's start with how to care for it if you have not had any surgery. So the FUPA, you can't ignore the FUPA, right? I think there's a girl on IG that I follow that says that you have to lift it up and you have to clean up under there, and you do. So cleaning it would be soap and water. You can use antibacterial soap, just liquid soap, solid soap, whatever, and a soapy washcloth, and you have to clean that area. Okay, you gotta clean it. You also need to keep it dry. Now I'm gonna talk about me, because sister got some meat on her, is that before I had FUPA removed or whatnot, or the penis removed, the paniculectomy, I would put antiperspiration. So that would be a white solid deodorant down there, and that's what would keep it dry. So I recommend some type of antiperspirant for everyone down there, because what it's going to do is going to decrease the risk, or it's going to decrease the fluid collection, not only in your penis, but in between your leg and your groin and in your vagina. Honestly, sometimes you'll have a smell or definitely sweat, dirt, dead cell collection, all of that in that area. So antiperspirant is really going to help with that, because what bacteria love that area. So bacteria love sweating, right? So getting some type of antiperspirant in that area is important. Now, we all know about Johnson & Johnson and powder, so I'm not going to recommend powder in that area, but just something to keep it dry. And I don't recommend any type of gels or creams, because that's only going to make it wetter, right? Chafing, you can talk to your dermatologist or your doctor about chafing and how to avoid that. But I found, hyperpigmentation and just, so you have to keep it lubricated, but you don't want it sweating, and you have to keep it dry. So the drier you keep it, it's going to be less chafing. Yeast collection. So I've seen people who come in and they have not regularly cleaned that area, and it actually collects yeast. So what do we use on babies when they have a diaper rash? It's the same concept. So I'm just gonna put that out there. We use nystatin powder and things like that on babies. So I would use something like that in terms of to help with yeast collection in that area. And these are my women with the larger penis that kind of hangs from hip to hip. Now, years ago, I attended a conference, and I think I was in residency also. And I remember the man standing in the front of the room, and he said a woman who has her penis removed, which we call a paniculectomy, will have higher self-esteem. And I didn't understand that. I'm like, what? Having your penis removed will increase your ability to exercise, to walk stairs, to walk inclines. It'll make you feel better about the way you look in clothing because you won't have to hide it as much. It will help with cosmesis in terms of, and also sexual intercourse, right, and activity, because a lot of us don't want our man seeing that when we engage in that activity. Also, I mean, think about just, you know, the actions during sexual intercourse, right? So a penis would kind of be almost a penis can be inhibitory in sex, and we can talk about that later. So getting that removed is really going to help you in that area, even if it's just mentally. It's going to help with hygiene, right? So all of those hygiene things that I just mentioned, there's going to be decreased chance that you even have to do that once you get your penis removed. So those are the big things. I remember, and I mean, I've already shared what happened to me, but I did not even know there's an area, there's a bone called the ASIS, the anterior superior iliac spine. And it's kind of like if you touch your hip, it's that bone that kind of sticks out. You know, it's kind of like, you know, you call it your hip bone, right? When you get your penis removed, you're going to actually feel that. You're going to feel that laying down flat or things like that. But oftentimes, if you have a penis, you don't even know that exists, okay? So I think those are the main reasons why people would want to get them removed. And then remember, if you go back and if you're going to do this, y'all try to do it after y'all done having kids, okay? Because all that scar tissue and everything that's going to form, and you don't know if you're going to end up with a C-section and all that. And then, you know, if you have kids, your stomach's going to get poofy again anyway, right? So that's one recommendation. Now let's talk about if you do have surgery. So let's say you have certain surgeries like a hysterectomy where they make a large scar, a C-section, a fibroid removal, or a myomectomy or something like that. It's really important that you keep that area, if your incision or your cut is in that area, that you keep it clean and dry. So what I tell my patients, I have like a lot of rules after my surgery, right? Or a lot of recommendations. And one is you want to clean your incision in the summertime 3 times a day. In the fall and things like that, I would say, you know, two times a day is fine. If I have a very large woman, 350 pounds, I'm going to recommend that they clean it 3 times a day. Why? Because that area, the penis, likes to collect bacteria. It likes to sweat. And so that increases your risk of wound breakdown, infections, seroma, and just overall not healing well, right? So what I tell people is get you a spray bottle. I tell them to fill it with, and this is only if you've had surgery. Don't do this if you just, you know, normal day. Fill it with 3 parts water, 1 part hydrogen peroxide. You're going to pat, okay? You're never going to rub. So after you take your regular shower, let the soap and water run over that area. You're going to take your soapy washcloth. You're going to dab that area, and you got to lift your stomach, right? Because the water is not going to hit it unless you lift it. So lift it up, take your washcloth, dab that area, and then 2 times a day, just in the bathroom, you don't have to get in the shower, get a wet washcloth, and then get your spray bottle, shake it up, and then lift your stomach and spray in that area, right, with your hydrogen peroxide. Diluted hydrogen peroxide mix, because what that's going to do is that's going to decrease the risk of bacteria collecting in that area, okay? And then once you're done, you're going to dab it dry. And I tell my ladies, you can use a pad, you can use a dry cloth or anything, but it's important that you put it under that penis and dry it, right? Because it's important that it stays dry in order for your incision to heal. So that's just kind of, you know, those are the biggest questions I get about the penis and how to clean it. And this is for women and those that love women who may be a little bit larger and things like that. But, you know, and I would never recommend surgery, but I have told you some of the benefits of having it removed. Now, if you do have it removed, remember there's 2 different surgeries. There's a paniculectomy, which means your penis is removed, and there's a tummy tuck. Those are 2 separate procedures. One is just removing the subcutaneous or the fat tissue and the skin, and the other one is possibly removing that, but it's actually, you know, shortening or cinching your waist and removing the fat there, or yeah. Okay, y'all. Thank you for listening, Dr. Nadiva.